Today we'll study our IMVOKE system. What is IMVOKE system? It is immune provoke. So it is some kind of innovative and integrative cancer treatment concept. The presentation is composed of three parts. One is clinical cases, and second is mechanism. And the last, hypothermia, we'll discuss about it by and by. First case is a lung cancer patient, 75 years of female. She was diagnosed 2 years before and operated segmentectomy last May 2022. Adenocarcinoma tumor was not so huge, only 1 centimeters. But the problem is the cancer recurred this year, 73rd of the March to this year. Tumor size become very huge, 6 centimeters. OP was scheduled this year, April 23. According to her, the past medical history, he was the breast cancer patient 4 years before. He was operated, but the breast cancer is triple negative breast cancer. It's not so good, it's a little bit so malignant. So this is her PET CT. This is her tumor, right? Lower lobe. Another one is this one. So March, take another CT, looks like this way, irregular shape. The cancer patient asked me whether her tumor can be reduced or no. I said, I cannot definitely say it can be shrink or not, but the problem is maybe the shape of the tumor might be smooth or smaller. And then some kind of changes might expect, but the tumor size you are not so sure because she takes only 6 treatments, very short time. This is her tumor, ranging from the right lower lobe to middle lobe. Her treatment was only 6 sections, 5,000 microgram of selenase and imiquimod 1 vial subcutaneous from April 11 to April 21. Almost for 10 days, 6 times of treatment was done. Her response was like this. After first treatment, she said, oh, I could not feel any back pain because he has severe back pain. Also pelvic pain, also flank pain. When she bent her waist forward because of huge mass, she experienced the flank pain, but that pain disappeared. And also, her urine was previously dark, but it became clear. So, and then she felt lighter. So before operation, it was March 6th, he took the biopsy. According to biopsy, it is adenoma. At the result of the gun biopsy, right lower lobe adenocarcinoma was diagnosed. So this is the size is 6 centimeters. So she took the operation. You know, the operation was dramatic. At first, she expected to remove right lower lobe and the right middle lobe also, because the tumor was across the 2 lobes. So the operation was expected 4 hours, and then his thoracotomy. All her right lobe, the chest was cut. The surgeon entered. He realized the middle lobe was clear. It's not affected. So he take out only right lower lobe. So the operation time was 1.5 hours. It was really amazing. So she was very happy about the operation. But the problem is, after operation, the biopsy was done. The biopsy was resulted is like this. Diagnosis was granulomatous inflammation with atypical pneumocyte. Meaning to say, it's no more tumors, not cancer. It became inflammation. The doctor was very confused. In March, it was diagnosed adenocarcinoma. But after the operation, the result was inflammation. What happened? So that's why they changed the previous biopsy result like this, revised diagnosis, April 29. This case was consulted by doctors, and the final diagnosis was agreed on. Meaning say, they neglect the previous biopsy. Adenocarcinoma, no, it was wrong. So granulomatous bronchopneumonia with caseous necrosis, anterior basal segment, the size was a little bit reduced from 6 centimeters to 5 centimeters. Before enter the operation, she took the CT on the April 22, just 1 day before, it was said recurrent tumor at right lower lobe. What you should understand, even though the surgeon said maybe it was misdiagnosed, in my opinion, the tumor can be reduced or changed to inflammation. Actually, chronic inflammation and tumor is very, very close. So this is my suggestion. The granuloma is like this. This is some kind of aggregation of macrophage due to chronic inflammation. It's similar small nodule. So this is her, the CT scan 1 day before the operation. This is the time of diagnosis, this way and this one. This one became this way. She is very happy. She is no longer cancer patient. She needs no chemotherapy. So he's very, very happy. Second case is, the first one is actually no chemotherapy, only the IMVOKE system only. But this one is with chemotherapy. This is the cervical cancer, 71 years old female, uterine cervical cancer. She was diagnosed May 10th. Tumor size was huge, 5.5, 5.6, 5.75. This is high risk of human papillomavirus, type 16. It's a very notorious one. It will also poorly differentiate, and squamous cell carcinoma. It's also lymph node was metastasized in right external iliac chain. Her SCC antigen is very high, 68. Normal should be below 1.5. So immediately she entered the chemo and radiation together. From May 29, she stopped the chemotherapy because it was too heavy for her to endure. That's why she could not tolerate that kind of the chemotherapy. That's why she stopped in June 11. Treatment was for 5 weeks, selenase, 5,000 microgram, 2 times a week, and the alpha-lipoic acid and other antioxidant once a week, and hypothermia once a week, and selenase 1,000 microgram daily. Also PBM, later I'll explain what is PBM, daily. This is her, the IMVOKE treatment. So this is time of the diagnosis. It looks like this one, huge. This is the PET-CT, this is uterus, this is cervix. Yeah, this almost reached to the end. And this is her uterus. MRI was taken also May 2nd. This is time of the diagnosis. You know, this one huge size of uterus cancer. After 3 sessions of the chemotherapy, July 3rd, the MRI shows like this, almost clear. No viable tumor anymore. That's why the doctor said, oh, I cannot say tumor anymore. So tumor gone, only with the 3 chemo and radiation. So she was a little bit confused. They took another MRI after 2 weeks. This is the second MRI, become better. The dark color become clear. We show another MRI. So this is much better, very white. This is time of diagnosis, May 3rd and 50th of July. So he's very happy. Result as mentioned, the no tumor, and then they said, no tumor, no operation is needed. You come again after 3 months. It's really lucky. I think it is some kind of miracle. With only 3 sessions of chemotherapy, how the tumor can disappear? Because it was the result of IMVOKE the system together. So third, the case, the bladder cancer, 73 years female, multiple papillary bladder mass. She was scheduled TURB. TURB means transurethral resection of bladder, August 30. But before the TURB, she took the CT on August 8. It was shown that multiple enhancing papilloma bladder mass, posterior, left lateral superior wall. The reason why she took this CT because she complained the left lower abdominal and the lower back pain. After the CT scan, it was shown that you may be the bladder cancer. We'll see the CT scan. This is urinary bladder. This is urine, and then this is the wall. You know, white one? This is tumor. You may see this one. Huge amount of bladder cancer. Especially the tumor was located upper portion, superior portion, the lateral, left lateral. Maybe I suspect this tumor might invade the muscle because it's huge and it's very close with the bladder wall. This is the cystoscope result. Looks like the grape bunch. You see this one? Huge amount of papillary type of urinary cancer. What was our treatment? Only 2 times of treatment, 2 sessions only. August 16 and August 21 only. What was the treatment? IMVOKE 18 milligram was intravesical instillation was done. Of course, 2 milligram was subcutaneous. Before that, we inject the selenide 1000 microgram into the urinary bladder 2 times. Selenide 4000 microgram IV 2 times, only 2 times. And the mineral and the local hypothermia only 2 times. Of course, PBM was daily. After first treatment, she said, before I had a back pain and the left lower abdominal pain, but after 1 treatment, she said, gone. I could not feel any pain. And then her face was shining, very happy. Wow, I noticed something happened. This is the result of the August 30. TURB was done. What was the conclusion? It was no tumor, only carcinoma in situ, meaning to this one, flat. It's not malignant, it's benign. As you have seen microscope that show the shape is like this, looks like the grape bunch. I suspect maybe it was invaded to the muscle, but not this one, she was diagnosed tumor in situ. So she was very happy. Actually, this is not from her, the blade, but this from another bladder cancer patient. After 1 session of the IMVOKE installation, she complains something coming out from his bladder. It's from his collector from urine. What's this? She said. I suspect it is some kind of tumors in your bladder, I said. This is the last case about the lung metastasis of the 70 years old male. He was diagnosed of renal cancer 2021, almost 3 years before. He was operated nephrectomy, right side. This year, he has complained of the 2 months of continuous sputum and then cough. That's why he submitted himself to the CT scan on August 14. According to the CT scan, the lung metastasis was finally diagnosed. She took another PET-CT September 9, and then the follow-up will be the September 25. After the CT scan of the September 9, she visited another hospital, said 3 nodules was noted, 8 millimeters and 2 millimeters and 3 millimeters. She was requested for operation, but he visited the previous hospital, September 26. The PET result was no lung metastasis. Yeah, that's why he was very happy. The doctor said 3 months later, see again for additional PET-CT. What was our treatment? From September 3rd to September 7th, only 5 days. 5,000 microgram of selenase 3 times only. The antioxidant 3 times. IMVOKE subcutaneous 2 times. Local hypothermia 2 times. Of course, the PBM and salt hypothermia daily or schedule. So we'll compare the 2. August 14, this is the blood vessel. This is the location of tumor metastasis. Also, this is the same location. This is blood vessel. In the CT, it was shown this way, but according to the PET, the shining 3 spot, this is his lung metastasis. Very tiny. Yeah. Because of this, the doctor said, we cannot say it was metastasis. Okay, just see again 3 months later. This is the same location. It became this way. This is also the same location. It became very small. Until here, we discussed the recent good results from our hospital. Thank you.